Good morning, everyone. Apologies for a few minutes of a late start. We're navigating some technical challenges, but want to make sure that we provide the best quality event for you here this morning. So thank you for those of you who are joining us online. This is the fifth CNIC event of the year, 5 and 4 months. So we're rolling right along with the content. For those of you who don't know me, I believe probably everyone online does at this point. I'm Andrew Teal. I am the Executive Director of the CNIC. The CNIC being an organization that has been around for about 4 years now, advocating and educating members of the public, nuclear workforce, health sector, and many others about the important role that medical isotopes play in our society and the critical role that they will play moving forward in transforming cancer care and treatment for patients. Since our inception, the CNIC has grown from about 16 organizations now to over 75, 3 of which you will hear from today, as well as our partners at the Canadian Radiation Protection Agency, whom with this event is brought to you today, about the importance of transporting medical isotopes, how it's done, as well as the many feats that these companies overcome to make sure that the isotopes that are critical for patient care are delivered on time and make it from point A to point B in order to save people's lives. Before we get into the topic of today's event, I did want to touch on one thing, and that's the CNIC's Isotope for Hope campaign. It was 2 weeks ago, the CNIC was joined by over 400 people in Toronto, both virtually and online, to launch our brand new Isotope for Hope report and campaign. We brought together all levels of government, people from within academia, the health sector, and across industry to demonstrate the role, the Canadian leadership, and the role that companies play in Canada to ensure that people have access to the transformative treatments in order to change people's lives. Our CNIC chair, James Sconiac, provided some very stirring words. If you have not seen that event, I would invite you to visit our website at canadianisotopes.ca to watch that stream after this one, of course, to read the report, as it is the foundation of everything that the CNIC will be doing moving forward this year. Our Isotopes for Hope campaign is our benchmark campaign this year. We invite you to engage with us on social media throughout the campaign. And again, just really want to reiterate the importance of the work that campaign is going to be bringing over the next 12 to 16 months. So without further ado, let's move on to today's event. The theme of the 2023 Canadian Radiation Protection Association Conference is Working Together, which provides a forum for the nuclear and isotope communities in Canada to share ideas and innovation to improve safety, efficiency, while upholding regulations. This event, in partnership with the CRPA, will address innovation in radiation protection in medicine, including new technologies and techniques to package and move radiopharmaceuticals. In addition to various isotope producers and irradiators, Canada is home to a network of companies who provide logistical support or produce the equipment and technology needed to transport radioactive materials while protecting employees and end users alike. This Canadian Nuclear Isotope Council was created to help form connections within Canada's isotope community and raise awareness for the role in modern healthcare. Working together is key to fueling innovation in transportation, handling, packaging in the isotope industry. Today's event, we will offer keynote remarks from a representative, Jeff Fleming, who will speak momentarily from CRPA about the importance of working together in isotope and in the isotope and nuclear industries, in addition to several featured presentations from companies across Canada who specialize in safe and efficient transportation and packaging. To start us off, I'm pleased to introduce Jeff Fleming to provide a few keynote remarks. Jeff Fleming is a radiation professional who has been practicing in many areas of radiation sciences and protection for 15 years. He is based in Mississauga and proudly serves as president-elect of the Canadian Radiation Protection Association. Over to you, Jeff.
Thank you, Andrew. So thanks, everyone, and welcome to this, the first event here with CRPA and CNIC. Glad you could make it on this sunny day. If you're where I am in Ontario, you'd be hard-pressed to say it's not July outside, so I don't blame anybody for being in front of the computer or I give props to anybody being in front of the computer today. Just start with a little disclaimer that the thoughts of my talk here are mine alone and don't and as a member of the CRPA and don't reflect the view of my employer. So with that out of the way, I have to say when CINC approached us about this opportunity, I was pretty excited. We here at the CRPA have been building a robust professional development program for the past few years. It's really moved online, given the circumstances. But it's been great, and it was nice that this event came up, because for the past few years it's all been delivered internally. It's been CRPA members, kind of training, teaching CRPA members. So it's nice to have a view for our members to learn a little bit about the CINC and some of the interesting challenges their members have faced in radiation protection. So I think it's going to be great. So thanks for inviting us to this. It's another good event too, because it's going to allow our two organizations to connect, and I hope it'll really show the value to CNIC members of being in a professional organization like CRPA as well. We obviously have a little bit different motives than you guys, and I hope to highlight those today and why it's important. So today's talk will focus on the transporting and packaging of radioisotopes. I know a lot of our members are involved in shipping Class 7 packages, and probably more or just as many who use or study medical isotopes in particular. So this is going to be great. We certainly recognize the important challenges, including logistics around transporting medical isotopes and doing so safely for workers, patients, and the public. So with the theme of our annual conference working together, like Andrew said, I feel this is a really interesting concept for a group like ours, like CRPA. We're a member-driven organization, and we're only as strong as our members. So anybody who chooses to become a member to work with us, you're shaping the CRPA, and what you're doing is you're shaping the radiation protection landscape in Canada as being part of this organization. So the dance. Oh, there we go. Oh, sorry. I pressed it twice. Yeah, so who are we? So CRPA is a professional organization, strive to ensure the safe use of radiation protection by providing scientific knowledge, policy guidance, education, and expertise on radiation protection through public involvement, similar enough to CNIC there, and interaction with local, provincial, federal, and international authorities. The association first started in 1979, was officially incorporated in 82, and we have a variety of different membership opportunities. So there's individual membership, associate, full. We have student memberships, and as well as corporate memberships. And right now there are north of 200 members in CRPA. I do think it's important to note we're a professional organization. We're not a lobby or an industry group. We're made up of members drawn from all areas of radiation protection. So hospitals, universities, industry, nuclear power, as well as many levels of government are members of CRPA. We do have a lot of overlap with CNIC around radiation protection, so that's why I think this could be great. Maybe working more closely together, having some CNIC members join CRPA and really change that landscape I mentioned before, or promote it as well. So I think the primary area we could work together is ensuring regulators and the public are well informed with the latest scientific information on that safe use of radioisotopes. So again, we're a member-driven organization. That's what's, whoever's part of us is going to help push that forward. And there we go. So how do we work together? How does the CRPA offer to work together? Here's just a little map. I'll explain them all in a little bit of detail here. So our radiation professional designation. So we're the only organization that provides official registration for Canadian radiation safety professionals. There's a lot of words there. Basically, the CRPA-R designation indicates an individual has acquired training experience required of an entry-level radiation safety professional. So there's a lot of value in becoming a CRPAR. There's a lot of value to organization staff who are in radiation sciences and safety, that their staff have this designation. It shows that person is at the level of a radiation safety professional, and that can be communicated to whoever you're working with. It'll be recognized. An important area is where we work together, where I see here is for CNIC and us is our working groups. So we have a few working groups. I think one of them is working with the CNIC. So we have regular meetings with them about topics that affect our members. We have another working group called the C3, which is more accelerator and medical physicist and CNSC interrelated. So those groups are quite functional. A lot gets accomplished in meeting with these, with the regulators and with other professionals. Another one is our policy feedback. So as new regulations come through, depending on their relevance, CRPA will talk about them internally and provide collective feedback on how we think they work. Are they going to protect the public? Are they reasonable for the current practices that radiation safety professionals do? Those kind of things. So much like you can provide individual feedback, our members will kind of put the CRPA stamp on it when we provide that feedback. Another one, we are a professional organization, so networking. Radiation is a pretty small world. It's always good to know lots of people. Each year we do have a conference with scientists, workshops, and training. It's really a great place to show off your expertise in radiation safety and radiation protection, new and interesting things you're doing. I know CNIC has a lot of that going on. So it's a great way to showcase. Like any good conference, there's plenty of opportunities to connect with old friends and meet new ones. I think networking is so important, especially as time goes on. Things move more virtual. It's great to see people in person and really get that one-on-one connection to make things happen. Mentoring is a neat one that we do that could really be of value to CNIC members. So we have mentorship opportunities that are available for students, young professionals. There's actually a membership or a mentorship list on the CNSC website of folks who have offered their mentorship services, if you'll call it, to a limited capacity up to people who are interested. So it's there's always that, and it's great. Or our members can give that out. It'd be great to get more members who can mentor the next generation as well, or just those that don't have experience in a particular area. Transport would be a great one. It would be great to have some folks on there who can really speak about the logistics or operational challenges and what they've overcome or interacting with regulators. So I think that would be great. For mentoring, we have some lively email lists where people discuss lots of topics. I saw a few messages bouncing around this morning. And as time goes on, we're increasing the number of tools we have for our members. They include handy radiation calculators or whatever our members will find interesting. The one thing I'm proud of is our professional development program, which this kind of falls under, I'll say. For us, we've been offering a lot of synchronous and asynchronous training. We still have in-person training at our annual conferences, and there's just a lot of great information to be shared there for members and even non-members at a very reasonable cost. And then our relationships. So we are affiliated with the International Radiation Protection Association, and members do have access to the ICRP annals at no extra cost. So just a little bit about our corporate membership. That's kind of how our corporate memberships look and start. They include lots of various benefits, including individual memberships. You can learn a bit more about our website if you're interested. Our upcoming conferences, Halifax is our big one this year. Very excited to be back in person. I know everybody is. So if you're interested, there's still time for that one. And then on the radar, there'll be our annual conference in Edmonton next year, and we'll have representatives at the IRPA conference in Orlando as well next year. And really, that's it for now. So there's our contact information. Feel free to reach out to us if there's any questions. Thanks.
Awesome. Thank you so much, Jeff. I think the really important thing that I want to highlight, and the reason that the CNIC is bringing CRPA forward, obviously they offer a lot of great services, but it's really to understand the integration between radiation protection and isotope packaging. And the conference, I think, is going to be a great opportunity for our members and their members to, obviously, as Jeff highlighted, get together. But it's really about that education piece and understanding the role of radiation protection in this industry. As we are all very much aware, it's a topic of conversation when it comes to the nuclear field. So it has to be well understood. It's a very heavily regulated area. So again, working with the CRPA in this instance is really to demonstrate the very diverse policy area that exists, helping people to circumnavigate and understand it, specifically as it pertains to medical isotopes. And that's what our next series of presentations is actually going to be about. We have 3 great CNIC members who their fundamental job is making sure that products get to patients on time, safely, and uphold all of those regulations. Now, we're not going to bore you with what those regulations are, and I'm not saying that's boring for everyone. It's just a lot of reading that we can all do at another time. But what I've asked our presenters to do today is to tell some stories about challenges that they've overcome, about how it is actually performed in the field, making sure that these products get from a radiator, which could be a nuclear source like Bruce Power or OPG, all the way from Bruce County, Pickering, into hospitals around the world, whether that's in Toronto or all the way across the globe. So I think we have some really exciting presentations coming up for you today that will demonstrate how this works in action. So with that, I'm going to turn it over to my first presenter, who is a good friend of mine, Mike Stoppe. Mike Stoppe is the co-founder and director of Pacer Air Freight, an independent freight forwarding company that specializes in time, critical, and expedited shipping. Under his leadership, the company has become one of the top providers of logistics solutions for the radiopharmaceutical industry here in Ontario. He is passionate about improving last mile logistics through technology, process improvements, and building relationships. Over to you, Mike.
Thank you. Thank you very much. I appreciate the CNIC for giving me an opportunity to speak on this really good topic, working together and transporting isotopes. The collaboration and working together is quite extensive for me. It started a long time ago when we first started my company. I had to figure out how to work together with 3 of my brothers, and that could get pretty difficult and interesting from time to time. But I remember a little while, maybe like about 10 years ago, my first ever real life experience transporting a medical isotope was me specifically picking up a radioactive box off a chartered aircraft in Buffalo and having to navigate my way through customs, coming back into Canada, and then taking it directly to McMaster's research reactor, where when I would arrive there, it was probably about 6:30 in the morning, and a guy in a white lab coat comes out and he's like, "Oh, thank you so much. I'm waiting for this piece." And me handing it to him, thinking, wow, the time critical nature of this product. I found it fascinating. So I continued to operate in the life science sector. And then the opportunity came with radioactive theranostics, where things took a turn and allowed me to. Hold on here, I'm trying to click on my screen. It's not allowing me to. There we go. Yeah, my slides aren't working. Okay. All right, so I'll just wing it here. So getting into that space and allowing me to operate allowed me to invest into my business. It was important that I started to train the personnel that here at my facility to understand the importance of radioactive products, training the drivers on handling and safely securing these items while in transit. I began with an investment of putting together my entire warehouse so it was temperature controlled, so we can help with some of the preconditioning of some of this packaging that's needed for some of these isotopes. They got to be held at certain temperatures, or the antibodies that are used to bind with some of these isotopes. And it was important at that time that I realized how critical this phase was. In order for things to get from point A to point B, there would be a lot of collaboration that would be involved, and we would have to figure out how to work with everyone in the supply chain to make that happen. So when I speak about working together, I put up a slide. It's basically working together with the customer, the manufacturing site, the governing bodies, and the logistics players. And all these companies have to come together and work together, because the customer, which is sometimes the end user, relies on every single point ensuring that they do their job to get the package and get the isotope produced and made and delivered to the specific location. So precision logistics is at the forefront. I have to work with the manufacturing facilities on production, timelines, when the product is going to be ready. Then I have to work with governing bodies. Could be anywhere from the airlines, it could be FDA, it could be Health Canada, it could be border protection, based whether it's in the US, whether it's in Canada, whether it's going or international destinations. There's all types of different governing bodies that we have to work with and make sure that they understand what we're moving into their country, and we're following their requirements prior to arriving at a border crossing and not having the correct paperwork or the correct protocol to get through the border. And then there's the logistics players, working with the airlines, working with my drivers and my staff. They need to understand what they're moving. They need to understand how critical this product is, showing up on time, securing the product in the vehicle for safe transport. And then all three of these companies working together for one single point in mind is making sure that the consumer, the end user, which at times can be anywhere from, it could be a patient, could be several patients, or in a story I'd like to discuss a little bit would be a child. And we move a product. It's iodine 131 and MIBG, and it was quite interesting to understand and work and collaborate with my customer to understand where this stuff is going, what's needed on the other end. There was a lot of legwork involved. Us having to pick up at a certain time, hold and wait at the border, deal with the customs agent that we have to work with. So whether it's Livingston, Delmar, and teaching those staff on making sure this gets processed right away. I mean, you'd have times where you'd pick up the phone and say, "Hey, what's going on with this shipment? I got to get through the border. Have you processed it?" And the person on the phone would just tell me something like, "Oh, you're in the queue." And I'm like, no, we cannot be in the queue. This is for a patient. It's for a child that's waiting for this treatment. You have to put this on top priority. And us training and teaching these customs brokers on the product, that it's not just a piece of paper or a car part, it has to get processed right away. This stuff is losing its shelf. It's had a shelf life. It has a level of potency, and it has to get to the destination. The child was waiting. They have to get prepped for the injection. The product has to be there prior to a couple hours before their injection. So there's a lot of collaboration that has to come together for us to ensure that these products get delivered precisely and on time. So when I speak, when you see the next slide, it's very, very much about customized solutions from start to finish. About 2.5 years ago, I had a opportunity to work with a power plant and work with a number of other individuals that were involved in a product that had to be moved from a nuclear reactor all the way to Germany. And there was a lot of regulations that we had to work on. We had to work with the power plant on what their SOPs were on picking up from their facility. And we had to develop an SOP on the process so that my drivers can be taught, and then they can teach other drivers on exactly the process at picking up product from this nuclear reactor, securing it, and then working with the airlines, because eventually it goes by road over to the airline, and teaching the airlines on this product that we're moving, because it was new to them. They had no idea. They've never dealt with something like this. So we had to go through all the paperwork and show them how to look at this material and understand, and teach them things that they've never found. They would look in the IATA book and they would say, well, we don't understand how to read it. So literally my staff would have to show them and teach them on what this product is, how it's approved by IATA, by regulations. And it's these things that are so critical to ensuring that stuff gets delivered on time. Prior to even moving product, we have to do mock trials on samples, shipments, just running through the supply chain, just to make sure that when it goes live, we don't run into any of these hiccups. We address them all prior to executing a live shipment. There was another situation that we encountered. I had a customer that was based out in the Vancouver area, and they normally ship on a regular basis with FedEx. But what happens, sometimes when there's a holiday in Canada, FedEx is closed. But that same shipment still has to get produced and shipped to the US, to hospitals that are open and patients that are waiting for this product. So we had to work with Canada Border Service Agency. We had to work with Border Protection in the US on what their protocol is at bringing this product to the border. They normally were used to handling very heavy, light water shipments, and said, no, you can't bring that stuff. I had to coach them and teach them and let them know that, hey, this is not a heavy water shipment. This is not your typical cobalt. This is many small boxes that are used for therapy that have to get across the border. And I don't have time to wait 10 hours till midnight where you guys can allow this. I need you guys to make an exception here and work with my team. We will put together the SOP with you guys. And I had to go back and forth, send them our SOP. They had to go back and read the SOP and then finally approve it. And at that time, I can go back and say, hey guys, I'm ready to start live with the shipment. So when FedEx did close on a holiday in Canada, we were able to pick up the shipment, follow the protocol that was required at the Border Protection on time, and then again, proceed through the border, clear the border, and then head over to the FedEx depot and place the shipments in FedEx's hand, so they can then do the final mile to the destinations of all the different hospitals that these items need to be delivered to. So planning from start to finish is critical. This is exactly precision logistics at its finest. There's every part and every team has to collaborate in order for that precision to take place. Working with everybody effectively and safely, and collaboration allows this process and execution to take place. again, I just want to thank the CNIC for allowing me to have this platform to talk a little bit about what we were able to do, working with all the different parties that are involved. And thank you very much. Have a wonderful day.
Thank you very much, Mike. Really appreciate it. And thank you for those specific examples. I think it really illustrates just how critical it is that we work together in this industry and how just on time it really needs to be when it comes to the delivery and shipment of these critical materials. Next up, I have Robert Kamen. Robert Kamen co-founded Southwest Exposures in 2017 in response to industry needs and anticipation of the emergence of theranostics. Rob brings over 15 years of clinical leadership at the University Health Network, specifically in nuclear medicine, patient flow and clinical utilization, to his role as a consultant for independent health facilities that provide medical imaging services across Ontario. I just wanted to remind everyone as well, if you do have any questions for our speakers, please put them in the box in front of you. We will hopefully have some time at the end. If not, we do record all the questions and I will distribute them with the speakers and get back to you at the end. So Robert, over to you.
Thanks very much, Andrew. I really appreciate the opportunity to present today. Good morning to everybody in attendance. The focus of our presentation today is packaging, transporting, and safe handling of radioisotopes in the emerging theranostics market. We are Southwest Exposures, or SWE, is a proudly Canadian company, and our products are made and engineered here in Ontario. So I just wanted to highlight that as we start our presentation. So just want to take an opportunity to introduce the Southwest team. We have a long history of working in nuclear medicine and radiopharmacy. Our professional experience and expertise covers a wide range of skills and knowledge that are directly relevant and applicable in the theranostics space. Our focus on the science, regulations, and safe practice of nuclear medicine inspires us to continually work towards increasing radiation safety for our professional colleagues and improving patient access to these life-saving diagnostic and therapeutic agents. I want to take a moment to introduce my good friend and professional colleague, co-founder Sean Ramdani, who's a radiopharmacist. Sean and I worked together for many years in clinical practice. Sean has over 20 years of clinical, commercial, and academic experience. He's a regulatory expert in radiopharmacy, aseptic production, and radiation safety. Sean's held many very responsible roles, including being past president of CARS, which is the Canadian Association of Radiopharmaceutical Scientists, Health Canada and CPSO advisory boards on radiopharmaceuticals. Sean is the co-founder, the CSO and board director of Newcomb Associates, Inc., which is a Health Canada licensed radiopharmaceutical manufacturing facility in Oakville, Ontario. My own clinical experience is I have 20 years clinical experience and academic experience in nuclear medicine. I'm a nuclear medicine technologist by training. I've trained in radiation safety and also business administration. That's my role at Southwest Exposure. I'm the past chair of the CAMRT exam validation committee. I'm a member of the CMRTO. I've held positions as an elected board member of the CMRTO, and currently I'm the CPSO lead assessor for nuclear medicine IHF in the IHF community. My training in radiation safety officer is in the handling and response to emergency accidents. I was trained in the U.S. at REACTS, which is part of the FEMA framework for protection in the U.S. I should also add that on our team we have a CR member who's a physicist and a safety specialist who helps to hose and make sure that our products are responsive to the radiation safety requirements of the isotope that we're moving. Our mission is to design and fabricate products, that shielding products, customized or commercialized shielding solutions that optimize safe radiopharmaceutical use from bench to bedside. So we work with manufacturers all the way through transportation logistics experts to hospitals that administer directly to patients. Our vision is to become the gold standard for nuclear medicine and theranostic shielding. Southwest SWE, we really focus on the 3 Ps. Those are the public, patients, and professionals, and providing a safe environment for everybody involved. Southwest Exposures works with a number of industry partners, and this is not an exhaustive list, and it's a growing list. Our partners are radiopharmacies, CDMOs, biotechnology companies, universities, university hospitals, as well as clinical nuclear medicine departments. Excuse me. These organizations are really driving the advancement of cancer care throughout North America and globally. Pardon me. Their investigation and application of theranostic agents and drugs are pushing the boundaries of science and creating new options for the detection and treatment of multiple different cancers. SWE products are supporting these efforts and can be found in clinical practice and clinical trial settings in North America, Europe, Australia, and beyond. Shielding and packaging, as Mike said, are often a last 100-mile or even a long consideration. At SWE, we endeavor to work with our partners, be it the biotech or the CDMO companies, early in the drug filing, investigation, and development process to offer solutions that will shield and package the products and move with the drugs through clinical trial all the way to drug approval. It's perhaps an important moment to stop and think about what is theranostics. Theranostics is a derived term. It's the combination of diagnostics and therapy. The earliest example of a theranostic drug is I-131 for the detection through imaging of thyroid pathologies and the administration of intermediate, which technically speaking would be below 30 millicurie dose, to high dose I-131 up to 200 millicuries to therapeutically treat these pathologies. So thyroid pathologies would range from hyperthyroidism all the way through to thyroid cancer. In theranostics, we talk about theranostic pairs, iodine-131 being a unique theranostic agent in that it's both sides of the diagnosis and the treatment. But most theranostic pairs are diagnostic and therapeutic radiopharmaceuticals that access the same cellular structure and biological process. So that is to say, they share the same. Examples of this would be gallium-68 PSMA for detection and lutetium-177 PSMA for the treatment of prostate cancer. So just a little bit of background of what theranostics is. This is a bit of a busy slide, but I want to take a moment to to highlight what are the isotopes currently used in clinical trials. They're listed on the right-hand side of the slide. You can see they range from actinium-225, which is an alpha emitter, all the way through to zirconium-89, which is a PET isotope that emits 511 keV, as well as has some high energy beta components to it. The challenges in theranostics and some of the solutions that Southwest focuses on are highlighted in the arrows that you see in the circle. Specifically, there's increasing use of high energy radioisotopes in nuclear medicine and theranostics, and these higher energy, longer half-life isotopes lead to increased radiation exposure in all phases of the isotope life cycle. The isotope life cycle should be considered from production at either a cyclotron or a nuclear reactor, through processing at a processing facility to extract the isotope, onto a radiopharmacy to compound and dispense the isotope, through to logistics, which is transportation, all the way to the clinical administration to patients directly, and finally the disposal of any contaminants or waste products. So the radioisotope life cycle is really quite a broad continuum, and at each of these intervals, shielding is an important consideration. The next part of the challenge is that different isotopes have varying emission spectra, particularly from PET isotopes. So with PET isotopes, we talk about the dual emission of 511 keV photons, which is quite a lot of energy to consider. But it's also necessary for us to look at the other emissions from the isotopes, typically the beta energies that are also emitted that need to be considered in the shielding. So you can't throw the same amount of shielding at F18 as you would for gallium-68 or zirconium-89 for that matter. Another consideration or challenge in the emerging marketplace is isotopes that have carrier versus non-carrier. So a good example being lutetium-177. Here in Ontario, we produce a non-carrier added lutetium-177, but carrier added lutetium means that when it decays, there's also lutetium-177M metastable that has to be accounted for. The half-life of lutetium is roughly 6.7 days, whereas the half-life of lutetium-177 is almost 161 days. So when you start to deal with carrier added lutetium, for example, you run into waste management issues in Canada, as well as regulatory issues in the US, where regulations prohibit the decay in storage method for isotopes with half-life longer than 120 days. The next consideration, and this is always a consideration in dealing with radiation safety, is ALARA, trying to achieve as low as reasonably achievable exposure rates from the isotopes that you're managing. And it is always possible to get the exposure rate almost down to zero, but it's the reasonably achievable portion that constrains us, in that you don't wish to create shielding that is not movable or causes physical stress to move. So especially in the radiopharmacy environment, you want to have efficient shields that provide a high degree of radiation shielding and protection and are still practical for the end user to manipulate. In our case, we use primarily the shielding. Depending on the emission spectra of the isotope, we also use aluminum and or lucite to manage both alpha and beta emissions. But tungsten shielding and our principle of shielding at source allows us to reduce the volumetric size of package, lower the TI of packages, and which translates into increasing the number of packages that will fit within a commercial or cargo aircraft TI capacity. So the maximum total transport index number on an airplane cannot exceed 50. So by shielding at source and providing a higher level of shielding, we can reduce the TI, which allows more packages to get onto the airplane. Managing exposure limits to staff through the isotope life cycle is part of ALARA, and the solution is not to use more staff, but to use more effective shielding. The last consideration in this challenge is the regulatory considerations of CGMP and USP 797 and 825. It's important to recognize that lead is a neurotoxin. It's not a safe element to deal with, and lead is at a minimum, it's not the best option to be used within isolators, class 5, class 7 production and dispensing environments. So again, it favors the use of tungsten in those environments. I'm just going to move to the next slide that highlights some of the emerging challenges. We've all, as radiation safety officers and nuclear energy workers, we've always seen the slide on the top left side that shows alphas can be shielded with paper, beta can be shielded with wood, and gamma is shielded with lead. The truth of the matter is, we are not likely to shield actinium-225 with the Dixie cup, because it's not while the Dixie cup will stop the alpha, it's the daughter emissions of bismuth and francium that we need to contend with in the whole process of packaging and shipping actinium-225, as well as disposing of actinium-225. So there's a need to manage both the parent isotope and the daughter isotope, and look at the full decay scheme, as well as contaminants depending on the method of production, so that we provide adequate shielding throughout the isotope half-life or life. Alpha emitters are actively being investigated in clinical trial. Beta emitters like lutetium have already been approved for 2 indications: neuroendocrine tumors and the treatment of prostate cancer. Many other agents using beta emitters are continuing to be explored through clinical trials for an expanding number of clinical indications. Just to give a little bit of a perspective or context, beta emitters have a longer range in tissue. They don't have as high a linear energy transfer, so they don't pack as much of a punch. They tend to cause single-strand DNA breaks, whereas alpha emitters, which have a shorter range in tissue, have higher LET, causing double-strand breaks in DNA, so are arguably more effective in treating cancer. A good analogy of beta versus alpha would be throwing a grapefruit versus throwing a watermelon. So you could push a grapefruit further, but it wouldn't have as high an impact as a watermelon might. My last slide, I just wanted to highlight that some of the opportunities and options that Southwest offers. Our packages are designed to be used with any number of packaging configurations. The interchangeable foam segments allow us to allow end users to have a single package that works with a variety of shielding shapes and sizes. Our packaging solutions include options for thermal control, which is very important when working with antibodies. The thermal control we offer is across 3 ranges. That's ambient, 2 to 8, as well as using an overpack for frozen packages. Finally, at SWE, we offer health physics consulting, as well as package certification to IATA, DOT, and CNIC packaging standards. Grateful for the opportunity to be here today. I just wanted to thank Melody Greaves and Andrew Teal at CNIC, as well as Jeff Fleming at the CRPA. My contact details are available there, and I look forward to continuing to work with everybody in this emerging market of theranostics.
Awesome. Thank you very much, Robert, for the deep dive there and some of the issues that you faced and the challenges in the specific packaging that Mike was referring to in getting these shipments from point A to point B. Now, I just wanted to move on to our last speaker of the morning, my good friend Steve, who has overcome his own challenges to be with us this morning. So I want everyone to give a round of applause for Steve in front of your computers. He went high and above to join us this morning. Steve is the president and CEO of StevCon Packaging and Logistics based in Owen Sound. Steve graduated with a degree in business management from Ryerson University and later received his chartered accountant degree following the completion of his articling at KPMG. Steve has a vast and robust background, including owner and operation of one of the largest custom crating and packaging companies in Canada. Steve, over to you.
Thank you, Andrew. Can you, everyone hear me? Okay, that's good. I'm the reason that we're late this morning. We had a trial run a couple of days ago, and I thought everything was good. This is the punishment for being down in Florida at the moment today, and I don't have my IT team with me of one person, but I apologize to my colleagues, the invitees on the phone, etc. So hopefully I'll turn a 30-minute presentation into about 6 or less. So thank you and welcome all. StevCon Packaging. Melanie is working the slides for me. So StevCon Packaging has been around since 2019, but our affiliates, the StevCon group, was established in 1997, and we were a major supplier to the nuclear industry for many applications, which included offshore and Bruce Power, and also Gentilly and Point Lepreau and OPG. In 2021, I got this idea that this emerging market of isotopes would definitely be an opportunity for a company like StevCon, which has been involved in packaging, involved in hazardous material packaging, dangerous goods, military, etc. And I thought it would fit right into our wheelhouse as a supplier, and not just a supplier, but a testing of the product, a testing of our shippers to the nuclear safety standards, to International Atomic Energy Agency standards, etc. And we felt, and my team felt, that because North America is about 40% supplier of isotopes worldwide, Canada being a huge part of that, that there was an opportunity, because in our research, no one has one-stop shopping like StevCon can have. When I say one-stop shopping, I'm talking about testing to IAEA standards and packaging on a just-in-time basis and shipping to our clients with our own fleet of trucks. So I push for our logo, a truly Canadian packaging and testing hub. So next slide, Melody. I'll try to whip through as quickly as I can. Next slide is coming up. So we realized that we couldn't do all the testing at StevCon. We could do the drop test, we could do the water test, we could do the puncture test and a compression test, but we had to go to a company like Megalab Group, which is a great company, a large company that has all of the testing capabilities that we have plus more. And Megalab is located, has a office in Aurora. We work closely with them. Our philosophies are the same, and we feel that we're stronger together. And that's what we talked about, what Mike talked about, and what Robert talked about, is stronger together. And you know, when I went through the isotope for Hope, I was at the Empire Club, and the distribution that was prepared by CNIC and the booklet. You look at all these different memorandums of understanding and partnership agreements that have been signed the last few years. People realize that they can't do it alone. You've got a memorandum of understanding with Bruce Power and Boston Scientific for the Y90, BWXT and Triumph executing an agreement to produce actinium-225. CNL just signed an agreement with ITM to explore the industrial production of actinium-225. You've got the partnership that we all know about with Bruce Power, Isogen, and Saugeen Ojibwe Nation, and ITM to create a stronger supply chain. And StevCon is in discussions to be part of that supply chain at the front in Canada, and to accentuate their supply chain. McMaster, which has just become a client of ours, has partnered with Atom V to produce lutetium-177. A partnership with Laurentis Energy and OPG and BWXT Medical to produce Moly-99. Point Biopharma is partnership with Lanthi in the States, and Point is a client of ours. And then my good friend Daryl Spector, who's the president of Promation, has partnered up with MAC to produce more technological packaging solutions, packaging lines, and tooling and equipment for MAC and a few other companies like BWXT Medical. And we're in discussions with Promation to ensure that our packaging will be compatible with Daryl's packaging lines. So, and there's many more, but that was just to name a few. Next slide, and I'll skip through it as quick as I can. We decided that we needed to standardize our packaging. There was a number of things: standardize our packaging, and also to ensure that it meets the specs of the Nuclear Safety Commission, both from our testing in-house and our testing at mega labs. So what we did is we standardized a product line which is in the R&D stage, and it's almost going to be rolled out. We provided options to other corrugated boxes, because a lot of times corrugated boxes will not withstand the as Mike talked about, the handling and the shipping, etc., at customs and this type of thing. So we came up with other solutions, which you'll see in the next page. We've got a reusable packaging solution, which is certified and has been released to market, and we've already supplied those to the Isogen Group for the Yttrium-B203 to Bruce Power. And we also have a universal shipper that my team is working on now that has a 1 to 5 pack isotope, being cognizant of the transport index of isotopes. So we can put 1 to 5 in there, and it amortizes the cost over a 1 pack. The next slide demonstrates, the next slides after this one will demonstrate how StevCon conforms to the stringent rules and regulations for packaging. Number one, by ensuring through arduous testing that our packaging meets or exceeds the regulations, through new technologies, which we just hired a new individual that is heavily involved in this, and by thinking outside the box to react to ever-changing asks from our clients as they come back to us and say, can you do this? Can you do this? And the key thing is do that, but don't disrupt the supply chain. So the next slide is just a quick testing overview that StevCon can do with the water spray, compression, puncture test, and free drop. Mega Lab, they've got all the equipment, very sophisticated equipment for vibration, humidity indicators, temperature controls. Some of our clients have come to us and said, can you ensure that our package will maintain a -70 Celsius carrying capacity and temperature from the manufacturing to the end user? And that's a challenge, but we've tested it to -70, but normally it's -40 centigrade. So so Mega Lab has been a great partner for us. Other technologies that we've come up with was one of the things that the customers have come to us and said, we need to have a package that is aesthetically pleasing. So that's the next slide, Melanie. Aesthetically pleasing, because we're putting this $7,000, $10,000, $15,000 isotope in a box, and packaging is the last thing people think of, which I think Mike alluded to, and it's and obviously the price points on packaging is very small compared to what's inside the container. But we basically said, okay, we've got to make sure that it looks aesthetically pleasing, and we listened. We came up with a litho-laminate box, which is not new to the marketplace, but it has a sheen to it, and it's very clear marking and printing with the tapes and the tamper-proofing. We have a Coroplast shipper, which one of our clients in the U.S. wants us to look at, and we've provided samples. It has the integrity, the strength, and the compression test, and higher water resistance, and we put handles on it. And then, of course, we've sourced a made-in-Canada plastic case that is tamper-proof and waterproof. Next slides, above and beyond. Okay, what can StevCon do to enhance not just the packaging and not just the testing, but how do we ensure that we have an uninterrupted supply chain with the group and all our clients, and getting that isotope to the patient's bedside. So the clients have turned to us for one-stop shopping. They've looked at their threats to the supply chain, and we just had an example where one of the suppliers of one of the components to our packaging, they had a partnership dispute, and all of a sudden our supply chain was threatened because they were going to close down. And then they had these molds, etc. That who owns the molds, etc. So we helped with our client. We stepped in to help out. We haven't resolved it yet, but our mandate is to bring the molds into StevCon. We'll control them and give them out to a new producer, etc. So those are the things that above and beyond. And one of the other things that, and I'll be closing very shortly, Andrew, is that at StevCon and with Bruce Power, etc., we have decided to help establish a medical ecosystem, isotope ecosystem in the Grey Bruce area. And that's a long journey. And if you look up the definition of ecosystem, it is quite detailed, etc. But what we want to do is, as a platform for StevCon and our packaging, is to bring in the hospital, and Gary Sims, who's the president of Grey Bruce Health Services. We've talked with him. We've talked to Tracy Murray, the executive director of Saugee Memorial Hospital, putting a team together to say, why not Owen Sound? Why not Grey Bruce, to establish this medical isotope ecosystem with the hospital involved, have become a cancer treatment center in Owen Sound, etc. And we've got Steve Furness, the economic development manager, on side. We've got Ian Boddy, the mayor, and his team, and all of the city officials. So that's another thing that we want to do, and not just do the packaging and the testing. And the last slide is our product offering, which is just a sample of the reusable packaging, the dunnage inside, the Coroplast boxes, and the litholaminate box, and it's got the GPS tracking. They need to have that. Ice packs will go into the package to maintain a -40, and absorbent sleeves to cushion the vials, so we can standardize the lead pots, etc., and the ampules within the shielding. So that's basically my overview. Again, I apologize for being 7 minutes over. It's my fault. But thank you, Andrew. Thank you, Melody. I'm not a technical wizard. Especially down in Florida, my internet went off, etc., etc. So this is Trump territory, I guess. So something happened. I'm not sure. So thank you, Andrew.
No problem at all, Steve. Thank you so much for joining us. I think you've given me my new favorite anecdote. Whenever anybody talks about isotope packaging, I'm going to tell them that it needs to be aesthetically pleasing. I don't think I've ever heard that before, and that's quite incredible. So again, thank you very much, everyone, for joining us today. We really appreciate your participation. Thank you to all our speakers. For those interested in the CRPA conference, I encourage you to check out their website. And everyone, have a great rest of your day and a lovely weekend. Thank you very much.